There are some very valuable tips that I really would like to share with you over the years doing thousands of consults for patients who are trying to conceive that I have found to be very valuable for patients going through the infertility process. Number one, the infertility journey can often be treated as a marathon, not as a sprint. So it's very important to pace yourself, very important to take breaks, rest, also checking in with yourself, checking in with your partner, see how both of you are doing, and making sure you're also taking care of, during this process, your mental well-being, emotional well-being, and your self-care. And that self-care is more than just, having a couple hours a week to take some time off or something. It really has to be a bit of a deeper work when you're going through the infertility process, especially because there is a much higher risk of having things like anxiety, depression, going through significant amounts of grief in cases with recurrent pregnancy loss. So it's very important to take time to help pace yourself, to check in, making sure you're taking care of yourself, and you and your partner are taking care of each other when you're going through this process. And also, very important to vocalize your needs. So I often will do a bit of kind of one-on-one discussions with patients in addition to the fertility treatment and how they're feeling and what's going on. And I'll often notice there's a lack of communication between the two partners on what one partner would like the other one to do, so they feel supported, and that can be mutual. And it's sometimes just as simple as sitting down and making sure you're taking every week a few minutes, 10, 15, 20, 30 minutes to check in with each other, and communicating during that time on how you felt and what you would feel like would be important to help you feel supported and taken care of during this time and during this whole journey as well. Number two, diet and lifestyle. And I know it sounds like a broken record playing over and over, but the importance of diet and lifestyle, and more specifically, evidence-based changes to your lifestyle and diet, cannot be undervalued, and they cannot be I can't talk about it enough. There's more and more observational research and studies coming out looking at how lifestyle, diet, and overall preconception care can have a magnificent positive impact on reproductive outcomes, on fertility outcomes, on pregnancy rates. And so I find it's often an underutilized treatment avenue, and really it's just adjunctive care. So when patients come in, they're sometimes so far into that tunnel of, doing this medication and this and that, which is all wonderful. You have healthcare providers to look after you with regards to what are the best assisted reproductive technologies or medications for you to use. But it's important to not get that tunnel vision where we're totally disregarding that diet and lifestyle do have an impact on our overall well-being, and fertility is absolutely no exception to that rule either. And so I find also, it's easy to go on YouTube and to go on to Google and find, what's a healthy diet, and you'll find plethora of information and blog posts and videos and recommendations. And someone says, keto is best. Someone says go plant-based. Someone says don't touch protein or animal protein. Someone says stop eating fats. So it has to be targeted evidence-based care for you, for your specific conditions, your diagnostics, your medical history. So it's really important to have a one-on-one discussion with a licensed healthcare provider knowledgeable in this area to help you prepare and to help support you through your fertility treatments. And that can be very different for someone who has polycystic ovarian syndrome versus someone who has endometriosis versus supporting just sperm factor health for patients trying to conceive there. The third important thing I want to share with you is look at your options. Again, just with that tunnel vision, it's sometimes very easy to get into the repetitive process where patients are trying the same thing over and over and they're not getting results and they feel like they don't have any options. And often that's not the case. There are other options available. So it's important to speak to other healthcare providers, look at supporting your healthcare team for the fertility, looking at alternative lifestyles, alternative medicine, evidence-based approaches to supporting fertility outcomes, and sometimes speaking with a different fertility clinic as well. So sometimes, it's good to get a fresh set of eyes on your case and seeing, what might be a different approach to your case as well.